Started with today's session. So Sarai, I think we're recording, so we're good to go. So thank you everybody for joining us. My name is Berenice Pan. I'm with the Office of Family and Community Engagement and Education. And today we're with the Office of Student Health and Wellness. But we're gonna do some housekeeping before we get started with the session. And the first thing, as you know, we are recording the session today. And this is so that we can put it on our YouTube channel for those folks that are not able to join us this afternoon. They can see it. Or if you guys want to go back and see the video and get this information once again, you're able to do that. And we'll put the link on the chat for you. Today we have Booker Marshall, who's going to be joining us, our speaker, and providing their expertise in the topic for today. Remember, we are using a meeting style for today. So that chat will be open. The chat will be for you guys to write your questions or comments. The chat will only be seen by us, so the presenters and the host and co-host. So you will not be able to communicate with each other, but we will be able to see your questions and your comments, and we'll voice them over. If you do want to voice your question, you want to actually ask your question, you're able to raise your hand, and then we will unmute you, and you're able to use your voice for your question. If you want to use your voice for your question, just again, we are recording this, so you will appear on screen. And when you are asking a question, please be brief and keep it short so we can keep moving. And also know that we might not be able to get to all your comments or questions, okay, because we only have an hour. So just be mindful of that. The other thing I want to share with you today is our upcoming sessions. As you know, we have other sessions through the face-to-face programming. So on the 17th, we have ODLSS, and we have the mayor's office joining us that day, and the session is in Spanish. And then we also have ISAC. If you guys have students that are in high school getting ready to go to college, that's a session for you. And on Thursday, we have Ask the Expert with Dr. Suntak, who's going to talk to us about COVID, and the new vaccines for the kiddos came out. So she's going to give us an update on that, and also CPS policy. And on Friday, we have our Eat Smart and Move More sessions in English and in Spanish. So you can join. You see the link on screen or the QR code. You can scan that and go to our RSVP form and sign up to all right. So once again, welcome everybody. Let me give instructions one more time in Spanish for the folks that are just joining us, and then we'll get started. Bienvenidos a todos. Gracias por acompañarnos el día de hoy. Si quieren escuchar la sesión en español, por favor háganle clic al icono del mundo que ven en pantalla y escojan español para poder escuchar la voz de nuestra compañera dar la sesión en español. Muchas gracias. Thank you everybody for your patience as I'm providing instructions for our Spanish speakers. Once again, my name is Berenice Pan. I'm with the Office of Family and Community Engagement and Education for Chicago Public Schools. And today we have the Office of Student Health and Wellness, and we're going to be talking about sexual health policy updates. And our amazing speaker today is Booker Marshall, and I'm going to let them introduce themselves and tell us a little bit about themselves. So Booker.
Hi, I froze, so sorry. I assume it's my turn to talk. My name is Booker Marshall. Hi, everybody. I use they, them pronouns. I'm the LGBTQ plus and sexual health program manager in the Office of Student Health and Wellness at CPS. Here I am in the beautiful Loop office on the garden level. That's the basement. We're going to talk today about the sexual health education policy at CPS. It was updated in December of 2020, and we will talk about what changes have occurred. And then there will be time for questions after the presentation. Just a disclaimer, this work is funded by a cooperative agreement from the Centers of Disease Control and Prevention, the CDC, and the contents of this presentation do not necessarily reflect their views. So the Office of Student Health and Wellness mission is to remove health-related barriers to learning and advance health equity in Chicago. Our vision is to create a healthy CPS that serves as a national benchmark for student health and wellness. This slide describes the different teams within the Office of Student Health and Wellness. The sexual health work and LGBTQ support work falls within the health promotion team. Our office oversees a lot of other work, including health information and data, health services like dental and vision services, children and family benefits, so Medicaid enrollment, COVID response, of course, happening literally behind me all the time. So stressful. And then nursing, we have school nursing now, which is a new thing. So we can move to the next slide. Sorry, I might be freezing intermittently. Sorry.
Sarah, can you see my screen?
Yes, I can.
Oh, okay, yeah. I can see ground rules now. Can you actually go back to Healthy CPS? Thank you. Okay, so the Healthy CPS indicator is a comprehensive health-focused measure that's included on the CPS school progress report for every school. And parents and guardians and other community members, school-based staff, anybody can identify using this tool if your school is meeting certain health criteria that covers various things like chronic conditions, health services, health education, and staff training and general wellness. Sex ed does fall within Healthy CPS as a requirement for schools at CPS. So that's why I'm bringing it up here. You can go to the next slide. Okay, so we have some ground rules for the session today. And these are actually ground rules that teachers who teach sex ed at CPS use in their classrooms. It's not all of them, there are more of them, but today we're going to make sure that everyone's respectful at all times. Derogatory or disrespectful language will not be used. We're going to practice step up, step back. So just during question and answer, once you've asked your question, allow others to ask their questions as well, and give space to other people. Elmo, enough, let's move on. So we're not gonna belabor points for a long time. We have a short period of time today. I'm happy to address any and all questions, but we're not gonna keep harping on the same point, kind of like I am right now. Okay, next one. No preaching and no put downs. And then no question is a dumb question. So truly ask whatever questions you have. That's why I'm here, to answer them. Okay, some data for anyone who likes numbers. This is a graph of Chicago Public Schools high school student data from 1991 to 2019, which is our most recent data, from the Youth Risk Behavior Survey. This chart shows the percentage of high school students who ever had sexual intercourse. And you can see, normally I would ask you to participate here, but you can see from 1991 to 2019, actually a lot fewer of our students have ever had sexual intercourse. And you can kind of see here in 2013, the number was around 52%. Interestingly, 2013 is when CPS implemented our first policy that mandated sex ed from kindergarten to 12th grade. There's a break at 2015 because we did not get weighted data during that time. But you can see to 2017 and 2019, the percentage of high school students who have ever had sexual intercourse, even just one time, is going down really drastically. This chart shows the percentage of high school students who used a condom during last sexual intercourse. This one is a little different. You can see it started at 50% in the 1991, went up to around 70%. And it's been hovering in that range between like 50 and 60% for a long time. So, and that's important because our policy does cover condoms being available at school. So only about 60% of our students who reported being sexually active indicated that they actually used a condom during the last time that they had sex. So we have a few other data points here. 30, this is all from 2019. So this is the most recent data we have on CPS high school students. 31.1% of CPS high school students indicated that they had ever had sexual intercourse. So that's only about a third. 20%, 20.4% of CPS high school students who had sexual intercourse in the past, who had sexual intercourse had it in the last 3 months. And again, only 60% of sexually active CPS students, high school students, used a condom during the last time they had sex. And only about 20% of CPS high school students used birth control other than a condom before their last sexual intercourse. And then the number at the bottom there, only 5% of sexually active CPS high school students used both a condom and another form of birth control, which we know to be extra effective, like especially effective at preventing unintended pregnancies. So knowing the data, knowing that our students have a need for sexual health education, we did update this policy. Again, in December of 2020, it's being implemented starting this school year. So it's already being implemented. The policy is available publicly. You can perhaps, Sarahi, maybe we can drop a link to the policy. I think I included that. You can also always go to cps.edu/policy and search for any CPS policy there. And you can, I usually search on sexual health and it pops right up. So I'm going to explain the policy to you now, so you don't have to read it all, but you can read it all. Well, so when we were developing this policy, it took us about 1.5 years. We used a tool. It's a school board policy review equity rubric that came out of the Office of Equity here at CPS. It had specific standards that we had to meet. We engaged stakeholders, including our Sexual Health Advisory Committee, our sexual health education instructors, so the teachers who are actually teaching it at schools. Students, we engaged actual CPS students who are receiving sex ed or sometimes not. We did engage parents and caregivers. We engaged principals, and we worked with many different departments and internally at CPS, including ODLSS, the Office of Student Protections in Title IX, and the Office of Early Childhood, because we did add pre-K to this policy. There was a public comment period between October 9th of 2020 and November 9th of 2020, and the policy passed through a Board of Education vote on December 16th of 2020. So here's the overview. All students in grades pre-K to 12th grade are to receive sexual health education every year. So every student in those grades should be getting sex ed every year. All of the topics and lessons and skills outlined in the curriculum scope and sequence should be covered. So, and maybe we can drop the scope and sequence. It's some like education jargon, but it basically lists for every grade which lessons are being taught. And all of the lessons are age appropriate, developmentally appropriate, and aligned with national sexuality education standards. At each school, there has to be at least 2 instructors designated to teach sex education. A new change to the policy is that there's also a requirement that at least 1 special education teacher is trained. Ideally, many teachers would be trained, and we do promote that, and a lot of schools implement it that way, but we have a minimum standard in the policy. Our sexual health education instructors must attend sex ed training hosted by my staff, and they have to also pass a test. And we follow up with them about their incorrect answers. And we also don't allow some people to be certified to teach sex ed if they cannot pass that test, or if they express attitudes that are at odds with the content. I mentioned this, but the topic areas in sex ed are identified and aligned with the National Sexuality Education Standards. It's also aligned with Aaron's Law. Aaron's Law is a state law in Illinois and in other states that requires that students receive sexual abuse prevention education. So that's things like teaching students how, medically accurate language for their bodies so that they can communicate if they're being touched inappropriately. They learn things like who's a safe adult, what's a good touch, what's a bad touch. So things like that, it's all developmentally and age appropriate. And it's meant to prevent sexual abuse. The curriculum and the policy also addresses access to confidential sexual health services, including referrals for health services, so to medical providers, condom availability, and also menstrual hygiene products, which is also a state law. The policy also requires that parents and caregivers are informed, they're notified that sex ed is going to happen at their school, and they're given the option to opt out their children of that instruction. And that's a state law requirement. There should be 3 total notifications. One has to be in the form of a letter that students bring home to their family members. And then CPS approved community-based organizations can provide instruction. So there are some community groups like Lurie Children's Hospital, YWCA, Chicago Women's Health Center, Pure Health Exchange. There are a lot of them. And they can provide supplementary instruction in schools, but none of these organizations can provide the entire curriculum. So it's really important that our teachers are trained and equipped to provide sex education to our students. But they are approved, so they can come in and supplement. Okay, so some big differences from the 2013 policy to the 2020 policy. The first big change, it says my internet connection's unstable. Okay.
We can hear you, so you're good.
Okay, great. The first big change is we used to have a requirement that stipulated how many minutes of instruction were required by grade. So it used to be 300 minutes for kindergarten through 4th grade and 675 minutes for 5th through 12th grade annually, so every year. What we found, though, through our robust evaluation of the program, which is funded by the CDC, and UIC does that, is that teachers were skipping topics that they were uncomfortable with. And so that's not adequate for our standards. So we changed it so that the requirement is now that they have to cover all of the topics per grade. That way they can't skip material that they don't feel comfortable with. I've mentioned this, but another big change is we added pre-K. So we've worked closely with the Office of Early Childhood to roll this out with pre-K teachers. In pre-K, it's actually basically the kindergarten curriculum. And it's what I kind of talked about. It's all sexual abuse prevention education. It's very basic and anatomy terms, like how to be a friend, like friendship, healthy relationships, good, like safe, what is it? Yeah, good touch, bad touch. No, that's not it. And like how to talk to a safe adult. So the scope and sequence outlines that if you have questions. And the thing is, almost all of those lessons are aligned to Aaron's Law. So it is actually required by Illinois state law that our children as young as pre-K are getting this education because they need it to prevent child abuse. Okay, so I mentioned this as well. There were always 2 trained instructors required per school. We added an additional special education instructor if there's a special education program. And that's because we've received feedback that many times our special education students were being left out of sex education. And in fact, we know that special education students are at higher risk for sexual abuse. So it's actually even more important that they receive the education. So that's, again, a minimum standard. We are promoting more SPED teachers be trained, but this is just a minimum requirement. In 2013, access to condoms at schools was at principal discretion. So some schools have had condoms available for students for a long, long time. Some schools have never had them available until this year. In the 2020 policy, we now require that condoms be made available to students in grades 5 through 12. And that's aligned with our curriculum. Fifth grade is when contraceptives are talked about for the first time. So the idea there being that condom use, like normalizing condoms and the use of them should start early, even before young people are starting to have sex, so that they know whenever it does come up for them that they should and can access condoms. In the 2013 policy, there was no explicit mention of sexual health services, and we did add some explicit mention of sexual health services in this policy. And I'm gonna talk about the state law around that too, so that you all are informed. There's also no mention of diverse learners or special ed population or LGBTQ plus students in that old policy. And we did include them explicitly in the 2020 policy because we know that those are special populations that need sex ed and that need to, like, their context needs to be covered in sex ed as well. We also created another resource that's publicly available. You can go through it. The Sexual Health Education Policy Implementation Guidance. It is a tool. It's really meant for school-based staff, but it can be used by anyone. It's meant to help principals and teachers to understand these policy changes and how to put them into action, how to implement them, hence the name, Implementation Guidance. We worked with a working group of community-based organizations to draft this guidance. We also worked with our Sexual Health Advisory Committee, and we worked with students, principals, and sex ed instructors, that's sexual health education instructors, to revise it and make sure it was relevant and applicable to schools and the needs of schools. So this can also be linked potentially in the chat. We do have a general sexual health education web page that could also just be linked because all of these resources are there. But you can take a look at this document more in depth to see what all the specific requirements are. And if you're a parent or guardian, or if you're a school-based staff member, I'm sure we have a few, you can bring this to your administration if you are not sure if sex ed is happening. Ask about it. When is it happening? A lot of schools do sex ed later in the year, although we recommend it be as early as possible. But this tool was recently created just this summer. It was finalized, so administrators may not have seen it yet. So feel free to bring it to your administrators or your teachers. So the specifics of what are included in the guidance are, they're requirements, what is required, and also like best practices, like recommendations for how to do it. So that's like how to get all of the instruction in for every grade, how to support diverse learners, how to work with parents and guardians, specifics around how parents and guardians can opt out their children, staff training. So all of these different areas are covered in the guidance. It's comprehensive. And this is just an example of what it looks like. So the principal's role is also specified here, so that administrators can know, and family members, you all can know, what is the principal's role in sex ed. Okay, so I want to touch on sexual health services. In Illinois, minors age 12 or older can seek the following services without parental consent or notification. They can get contraceptive services, including emergency contraception. There's no age restriction on purchasing or possessing condoms. So technically that's under age 12 too. Children could purchase condoms if they wanted to. It's not illegal. Minors age 12 or older can also seek pregnancy testing without parental consent or notification. They can also seek health services related to sexual assault or abuse. They can seek STI counseling, testing, and treatment, including HIV. They can also seek mental health services, outpatient services, up to 8 sessions. And they can also get HPV and HBV vaccinations. Now, I want to touch on abortion because it's not included here. Recently, there was some legislation change. I actually don't remember when it takes effect, but there was a requirement if a minor age 12 or up seeks an abortion, there's a parental notification process that happens. So the provider can provide the services, but they have to notify the parent, and that can be a problem for some young people. So they recently repealed that, but I'm not sure right off the top of my head when that takes effect. And so that'll be a change coming soon. Okay, well, this slide is weird, but the condom availability program, you can just move to the next slide. The condom availability program I talked about a little bit. It's just the name for making condoms available to students. So why are we doing that? Well, condom availability in schools can help young people feel comfortable when they're obtaining condoms when they need them. A lot of our students may not be able to purchase condoms themselves, whether it's because they don't have adequate financial resources, because they don't know where to go to get them, because there's too much fear or stigma around accessing condoms or buying condoms at a drugstore or something, or for any reason really. And because condom availability can make young people feel more comfortable talking about condom use, including with their potential sexual partners. So just normalizing the fact that condoms exist and people should use them is part of why making them available is really important. And yeah, that says that at the bottom. It normalizes the idea of condom use, whether it's now or in the future when they're older. And as we know, most of our CPS students are not currently sexually active. So for many students, this is something that would be applicable later in their lives. Now, why 5th grade? So condom availability in 5th grade is in line with the CPS sexual health education curriculum, which is developmentally appropriate, vetted, and aligned to the national standards. And some Chicago specific data in 2019, more than 10% of our middle school CPS students reported ever having had sexual intercourse. So that's 1 in 10 middle schoolers have had sexual intercourse. It's actually 11%, so a little bit more than 1 in 10. Of those students who were sexually active, only 58% had used a condom the last time that they had sexual intercourse. So, we want our students, if they are having sex, we want them to be using condoms to prevent STIs and unintended pregnancy. So these are some additional resources, and we can provide these links in the chat. But I want to point you to specifically the sexual health education website. It has a lot of great resources that are really helpful for parents and guardians and also school staff, including the implementation guidance, which we discussed. There's also a resource that one of our partner organizations, Response for Teens, created. It's called Talking to Your Teen About Sexuality and Relationships, and it's available in 4 languages: English, Spanish, Urdu, and Arabic. So take a look at that. It's got really good information in it, in particular for parents and guardians. There's also the ACLU Minors Right to Confidential Health Care in Illinois guide. If you're curious about the sexual health services law, you can find out more there. And then also some flyers about condom availability for high school and middle school parents. And I can possibly drop some of these in the chat right now, actually. because I didn't give these to you, sorry. That's the condom availability program for high school. This is the condom availability for middle school. Oh, those are the ones I have up right now. So we'll get the other ones to you all as well. Yeah. And so that's my information for you. I'm gonna get these links really quick to the other resources. And now is your time to ask questions of me.
Thank you, Booker, for the presentation and all the information. So I'm going to let parents kind of take it in. It was a lot of really good information. So take a minute, parents, and take in the information that was given to you. What I will ask is in the chat, if you have questions, if you need clarification on something, you can also raise your hand. And then we can definitely unmute you in a minute, and then you can ask your questions. Again, I'm going to share what it was said in the beginning, right? Your comments or questions, please make sure that they're respectful of others' opinions, right? Also keep them short so we can allow other people to have a say or if they have a question, a time to say that as well, okay? And I think, Sarai, if you can see the queue, I think I know who was first and who was second, but I think we have a queue as well to keep me honest and who I'm pulling. So I think Hilda Hernandez, if I'm saying the name right, if you can unmute her and we'll have her ask her question.
I sent her the invite to unmute.
A mi pregunta cortita, ¿cuánto tiempo es el periodo que les dan a los estudiantes de high school las clases de educación? ¿Por 6 meses, por todo un año o a principios de la escuela o los 4 años?
Booker, the question, gracias Hilda por tu pregunta. Booker, the question is how long of a period of time do students get sexual ed? Is it every year, and every year do they get it for a month? Is it 6 months? Is it the entire year? How does that work?
Very good question. Thank you for that. It is every year. So every student should be getting sexual health education every year. Now, how long it lasts may vary from school to school, possibly even classroom to classroom. Some classrooms talk a lot about, in particular, using pre-K as an example, there's a lot of talk about friendship, how to be kind and respectful, how to talk about diverse families. All of that is sex ed. That's all included in the sexual health education curriculum. So some classrooms may go above and beyond and do a lot more. I'll say for pre-K and kindergarten, it's 8 lessons. So teachers tell us, if we give them 8 lessons, it could just take 8 days, right? Like 8, maybe 1 hour periods, probably less for young children. But a lot of times these lessons can take multiple days. So it really varies, but I'd say I honestly probably for younger grades, maybe 2 weeks. For older grades, it really should be more like a month. So that's a very good question. And the real answer is that it depends on the school and it depends on the teacher. And it can take a different length of time depending on the students in the classroom too. So if they haven't ever had any of the education, a teacher might have to start from a more basic place and then work up to the more advanced content. We see that a lot in ninth grade health education. A lot of times teachers have to start with the basics because some students, maybe they came from a Catholic school and they never got sex ed, or they just came from a school where they didn't get very much of it at all. So they have to start at a lower level and then work their way up. And so it can either take longer or they don't get, as in-depth of an education.
Sure, thank you for that. Cristina, if you can unmute her, Sarai.
¿Aló? Estoy ahí. Muchas gracias. Bueno, pues mi pregunta, muchas gracias por toda la información. Mi pregunta es en relación a la comunidad LGTBQ y si el señor Booker nos podría dar más detalles de cómo esta reforma y esta nueva póliza va a apoyar a esta comunidad? Esa sería la primera pregunta. Y la segunda es, ¿cómo es que los caregivers intervinieron para mejorar y en qué mejoraron esta póliza de la Agenda 2020? Gracias.
Muchas gracias, Cristina, por tu pregunta. So it's a one question, two parts. So you mentioned LGBTQ community in the policy. So if you can talk a little bit more in depth of the changes to support that community, what was brought up to support that community. And then also if you can talk a little bit about how the caregivers and parents were part of those changes to support their kids with this new change in the policy.
Thank you for the questions, Christina. So LGBTQ support is embedded in sex ed. Our curriculum is deliberately inclusive of LGBTQ identities. We updated our curriculum over the last couple of years and implemented the update during the pandemic in early 2020, January 2020, we rolled it out. And we made a lot of changes to be inclusive of transgender and non-binary people in particular, like talking about bodies without using gendered terms, for example. That was a big change we had to go through every lesson. And just being reflective of diverse family structures as well, recognizing that a lot of our students have LGBTQ family members and parents. So just being more deliberate about those pieces of inclusion. And then we also have a lot of programming around LGBTQ support more broadly, and I'm going to link to our webpage on that. You can take a look at the materials on this webpage. We have policy that protects LGBTQ students and staff. We have a gender support plan for our students who transition at school. We have a basic terminology guide that you can take a look at and learn some vocabulary. We also have a health equity report that reports data from the Youth Risk Behavior Survey, and specifically on LGBTQ students, because they face a lot of health disparities that straight cisgender students do not, because of the oppression that they face. So that report is really detailed, and it talks about some of the programming that we're doing as well at the end of the report. And there's also a supporting LGBTQ plus young people tip sheet for parents and caregivers that we created, because we kept getting questions from schools if we had anything like that. And so we created one. So that's that. And I'm happy to answer any more questions about that, but that's like a whole huge bucket of work that we do. And then as far as parent and caregiver participation, we did work with Healing to Action to get parent caregiver feedback on the policy, as well as we worked together on the implementation guidance. We also worked with a parent advisory group, a couple of them, to get feedback on sex ed and their experiences with sex ed and CPS. So we did focus groups right before the pandemic. It was like the last big event we did, Berenice, with like 90 parents in a gym.
Yeah.
It's crazy to think about now. So yeah, we got a lot of parent feedback at different networks on their experiences with sex ed. Do they know, is sex ed happening? Like, what do they want to see from sex ed? We had a lot of parents who wanted to know more about LGBTQ identities. That was a big thing that came out of that, and part of the reason that we created that resource. So yeah, so we did several different types of engagement with parents and caregivers. I hope that answers your question.
Thank you, Booker, for that. We do have Sarai, if you can unmute Ms. Latanya or Latoya. I'm sorry if I'm mispronouncing your name. I know you put something in the chat of, do parents have access to sex ed curriculum? I'm not sure if that was the question you wanted to voice over.
Yes, that was my question. As a parent, do we have access to the curriculum?
Great question. So our curriculum is in a Google Drive folder. To gain access to the curriculum, we ask that you work with the sex educator at your child's school to take a look at it. And the reason is a little complex, but basically We can't just share the Google Drive folder all the time. So like, yes, you definitely can and should be able to access the curriculum, but you need to go through your school. And if you want to talk to me more specifically about how to do that, we can chat. I'll put my email in the chat right now. But yeah, we have to, because we train our sex educators, we give them a test before we give them access to the curriculum. If we share it with people, then because of the way Google works, they can just share it with whoever. So it's tricky because we want you all to be able to access the curriculum, but we also don't want untrained teachers to be teaching our curriculum. So we have to like put some rules in place, some boundaries in place around that. But working with your sex ed teacher to take a look at it, usually at the school is how it happens, is definitely something that we train teachers on to be able to do. Does that answer your question?
Awesome. Thumbs up. So I think it did. Great. Thank you. And sorry if you guys hear my dog howling. An ambulance just went by. So I apologize for that. She howls. Sarah, if you can unmute Miss Emily. And Emily, if you want to voice your question.
Hey, I have a couple of questions, and so I don't know how much time we have. I'll just ask, and whatever you can answer will work for me. So if the principal is selecting two trained instructors within a school, how is it determined who those instructors will be, and how is that information then passed along to all of the teachers?
You sound like maybe you're a teacher.
I am not a teacher.
Okay, all right. So the way instructors are selected is on a school-by-school basis. Usually sex ed is taught during PE, especially at the elementary school level, and also at the 9th and 10th grade level, because 9th and 10th graders have to take PE. So
I will say, sorry to interrupt. At our school, sex ed has always been in the classroom, not in PE. So just.
And is that an elementary school?
Yes.
Okay. I actually prefer that. I would love to see all of our classroom teachers teaching sex ed. That being said, not every CPS employee should be teaching sex ed. So that's why we try to vet our instructors through this process of training them and testing them. Some teachers really don't want to. They're not comfortable with it, especially in the climate of like reporting sexual abuse. It's interesting because sex ed is sexual abuse prevention. It's proven it prevents sexual abuse, but teachers don't want to talk about sex because they're afraid of like getting in trouble. And that's like maybe an oversimplification, but there are a lot of teachers who are not comfortable with the content for that reason and for many others. Maybe they don't feel qualified, maybe they didn't learn health education in school. So I want to name that because many times teachers are told that they have to, they're told that this is a part of their job. I think the reality is for the younger grades, it's usually material that's already being taught somewhere else in a curriculum, whether it's the social emotional learning standards, again, like with the diverse family structures and that kind of thing. Some of the only material that's new usually is like the anatomy, maybe puberty once we're in 4th and 5th grade. And in some schools, they bring in an outside provider to cover that material, which is fine. But again, those outside providers can't teach the whole curriculum. None of them do. So yeah, some schools use their school counselors or school social workers to supplement. It really depends on the school strategy and programming and like how much administration has been able to prioritize getting this education to students. I think at the elementary school level, the ideal is the homeroom teacher. But maybe not every single teacher wants to or feels equipped to do that. So, that can get tricky. And I think that's really like a case-by-case basis.
Yeah. So Emily, I know you said you had other questions. We'll come back to you. We'll let other people ask questions. And then if we have time, then we'll come back to you. Okay. If you still have more questions. Awesome. Sarai, can you unmute Ricky's? I'm sorry if I'm mispronouncing your names.
It's Ricky.
Okay.
Okay, hi, my name is Ricky Jones, and I'm a community rep for a high school. I'm a little concerned. I'm not concerned as much about the sexual education portion because I totally don't get that yet, so I'm gonna have to read that. But I am concerned about the number of decisions that seem to be taken out of the hands of the parents in regard to young kids, like fifth grade and 12-year-olds, and I'm kind of concerned about that, the decisions making. And so I want to know why, what was your rationale for coming up with those grades, those ages? A fifth grader is a 10-year-old. I just wanted to understand that a little better. Thank you.
Thank you for your question.
Yeah, thank you, Ricky. I think maybe we emailed a little earlier, and I appreciate that, and I understand where that's coming from. It can seem young, right, to like be able to access condoms. The reality is there's no age restriction on condoms, and fifth grade is when they start talking about in the curriculum, and this is age appropriate, developmentally appropriate, when they start talking about contraceptives. Again, we know that 11% of our middle school students have had sex. We know that. They have told us that. So while that's not the majority, it is still a significant number of students across the district. And we, especially being in a district that's heavily like economically disadvantaged, as they say, we making something that's freely available to young people is just good public health practice. CDPH, the Department of Public Health, provides these condoms. CPS doesn't buy them. The health department already has them and makes them available to adults and technically to children as well. But putting them into schools is just, that's where kids are. So that's the main way to get them the resources that they might need. Now, most of our fifth graders are not going to need condoms, but also familiarizing them with what condoms are, how they're used, why they're used, what they're used for, is also best practice. It helps prepare them for when they're older and they may actually need to use a condom. And they may not need it till they're, way, way older. But by the time they need to use one, they'll understand what it is. They won't hopefully not feel like fear around it or stigma. It'll be normalized so that they can make healthy decisions for themselves. That was kind of a long answer. Did that answer your question?
I think so. Okay. If there's other questions, parents, you can raise your hand or put it in the chat. And don't worry, if you're a Spanish speaker, I will interpret those questions for you, so no worries. Sarai, if you can unmute Emily.
Hi, back again with more questions. This is kind of two questions in one, focusing on LGBTQ curriculum. I think the fact that it's now being included is amazing. One of the questions that I have about the specific curriculum, does it include things like how other students outside of that community learn about how to respect those within that community? Things like bathroom safety. Not all, I'd say probably most CPS schools, the gender neutral bathroom is a teacher bathroom. And so are we educating our students that a child might be using that bathroom for a particular reason? Like, is that something that's included in the curriculum? And then kind of the second portion of that question is, are things like blockers and hormone replacement therapy included in the curriculum?
Great questions. So I guess, what there is in the curriculum is information on identity development, both for people themselves and also respecting other people's identities. So I'd say it's probably like addressed in a more broad sense than what you're asking. There isn't like an activity on bathroom safety. So there isn't something that specific. It's more about, it is specific about like not bullying and, respecting people's identities and that sort of thing. I need to slow down. for the interpreter. I already know. Um, sorry, what was your other question? Oh, hormone blockers. So this is such a good question. My team and I were just talking about that. So in 11th and 12th grade students, there are like projects students can do. So like technically, yes, that's on the list of like projects they can do, or like research projects that they could go into, but it's not, I don't think it actually is addressed directly in other lessons. And that is something that we're talking about, including as part of sexual health, and in particular, a part of sexual health services access. So we're starting to now move like affirming trans-related care into all of our sexual health services material. And that includes the elements of that in the sex ed curriculum. But right now, it's not. It's not in there. What is in there is, again, gender neutral language for body parts, like being explicit about, using language like most girls have a vulva, most boys have a penis, and talking about and explaining, the instructors are supposed to explain why we're using that language, because not all bodies are the same. Not all people have the same type of body. And that's totally normal, whether it's because folks are trans or because they're intersex or because, of just natural human variation. So yeah, that's my answer.
Okay,
Thank
that
you.
is great. Thank you.
Thank you. We're gonna have 2 more questions. I know we're getting short on time. So there's a question in the chat. Is abstinence taught through the curriculum?
Yes, we do teach abstinence as the only 100% effective way to not get pregnant and not get STIs. So it is included. We also talk about contraceptives because we're speaking to a range of young people who have various needs. So, but their abstinence is definitely included along with contraceptives.
Awesome. Great. Sarai, can you unmute Ms. Marita? And I think we can hear you. So if you wanted to have your
Hi.
question. Hello.
Yes, I have a question. So is the curriculum based on grades the same for students with IEP? Like would my 5th grader who has an IEP have the same sexual education curriculum as the kids in the standard 5th grade class?
Thank you so much for that question. It's a very good question. And that decision is actually made by the teachers at the school. So it depends on the needs of your student. Some students with IEPs are receiving the exact same lessons as the rest of all students. Some students in cluster programs may not. They may, if we're talking about a 12-year-old, they might be getting something that's more like a kindergarten, first grade lesson. It might be more about it's meant to be at the level that the student's at, but they should still be getting the same messaging, the same skills. And again, it's going to be really based on like, what has that student received prior to that time? Did they switch schools and their other school didn't do sex ed with them? So they might have to start somewhere else. But yes, they're meant to receive the exact same education. That is the goal. And I think it's a great question. And I encourage you to ask your school, the educators there. Again, sex ed is often taught in like April, May. So, I mean, it's good to start asking now, like what their plan is, especially if your student is in like a self-contained class, because a lot of times those classes tend to be skipped over if they're not in like PE with the rest of the class, if sex ed is taught in PE. So I would definitely follow up and like see what the plan is for sex ed, and you can ask more directly, what lessons will you be covering? Because it may be the 5th grade lessons, or maybe they'll weave in some of the other grades potentially. It is customizable. The schools can do a little bit what they want, but they're meant to do the lessons of the grade that the student's in, for sure. I hope that answers your question.
Thanks, Booker. Thank you. And I think those are some really good questions. And as Booker mentioned, like one of the things for us as parents, as you guys know, my munchkin, who's not a munchkin, it's a 12-year-old, right? We have a lot of questions. So having that open communication with the teacher, the administrators, right? To know what they are going to be teaching, or if they're already teaching it, ask those questions, send them an email. Report pickup is coming up. That's a great time when you're going to be meeting with your teacher to ask some of those questions to see what's going on in the classroom. So it's coming up. Make sure that you have, I always do this with my husband. We write our questions ahead of time because once we get there, we forget. So make sure you do that so you can ask them. We're coming to a close. We have a few more minutes. So Booker, I want to give you the last word. You gave us a lot of really good information, a lot of really good questions from the parents. From everything that you talked about today with us, what's the main point or the main topic of information that you gave us today that you really want people to take at heart and like think about it and really take at heart?
Wow, Berenice, it's a pop quiz. I mean, I talked about the policy, but what I really want as parents and caregivers is for you to be talking to your children about sexual health and mental health. It's really stigmatized in our culture, and we don't want school to be the only place that they're receiving this information. So, and also like find out what your school is doing. And if you find out that they're not doing sex ed or they don't have a plan yet, my team can help that school figure it out. So you can actually reach out. I mean, you can email me directly, or you can just email oshw@cps.edu. That's the Office of Student Health and Wellness. And it'll be directed to my team, and we can help support the school to figure out how they're going to implement sex ed. They might just need to get a teacher trained, or they might need to develop a plan for certain grades to receive the education. So I guess like that's what I would love to like assign you as homework is figure out what your school is doing for sex ed. And report card pickup really is a great time to do that. You can talk to the administration, might be the principal or assistant principal might be the right person to ask. You could also try the PE teacher or homeroom teacher and see what they have to say.
Yeah, for sure. No, thank you for that. So, report card pickup is coming up for both high school and elementary school. So use that time to talk or email your administrator. That's always, we tell you parents at every session, right? Keep that communication open with the schools to know what's happening, how you guys can support, so we can all support the students to do well. So with that, I'm going to close out our session. Booker, thank you so much for joining us. Amazing information that you gave us. Thank you for answering all the questions that the parents had. That was great. Parents, thank you so much for coming and for asking questions and being here and being open to learning what's going on and supporting your kid with sexual education. So I appreciate everybody's time today for joining us. To our interpreter, Sylvia, thank you so much for interpreting to our Spanish speakers. Thank you, everybody, for joining us, and have a great rest of your night. Bye, everybody.